Good afternoon, Dr. Bishop.
Hi, Dominic. How are you?
I'm good. How are you doing
Pretty
today?
good. Pretty good.
So I'm just gonna start and ask you a few questions. So my first question for you is, what made you decide that you wanted to start a program such as the YES program?
Okay, so yes, our Youth Empowering Strategies started about 14, 15 years ago, and it actually came about from my work in terms of advocacy for school-based health centers. So we had just opened a school-based health center at Roberto Clemente Community Academy, and the health centers typically had three things that we did. One, we took care of patients or the students, so medical. The other one was that it was a site in case people had issues and wanted to talk, so behavioral care. And then the third that we thought was important was health care education or health education. So being able to teach the students about their health and teaching them that the choices that they make may affect their health. And so that piece, the health education piece, became YES, Youth Empowering Strategies.
Okay. So you stated that you originally started in one school, but how have you kind of stepped out of that? Have you gone to other schools? Have you spread out this YES program?
Yes, so now the Youth Empowering Strategies or YES program is in 4 schools. So we're at Pedro Albizu Campos, we're at Westtown Academy, we're at Wells High School, and we're here at Josephinum Academy.
So has the peer education model, has that always been a part of YES and something that you wanted to do and start?
So the peer education model was the foundation for the YES program, where I trained in adolescent medicine in Washington, D.C., and in other programs that I have visited in Boston and on the West Coast. Peer education was the way that they provided education, with the idea being that we as adults can give you guys a lot of information and you take it, you know, you guys are old, you're nagging at us, whatever. But when you guys have problems or you go to somebody for advice, you go to your friends, you go to your peers. So what we learned is that a lot of teenagers, most teenagers, they want so much to be acknowledged by their peers or their friends that if there was a way of educating teenagers to then share that information with other teenagers, that would be a nice way of educating and of being able to reinforce the messages that we're trying to provide.
So being that you said about how you want to interact it so that they understand those things, how has the program got to where it has today, that it's been effective and sufficient and a learning experience for teens?
Okay, so I think it's effective and I think it's an educational program. I personally don't think it's sufficient. Sufficient to me means that we've achieved, you know, the utmost, and from here there's nowhere else we can go except straight or down. I think we're still on the way up. So in terms of effective education, I think one of the biggest things are the teens themselves, the students themselves, like yourself, that have opinions, that care, that are willing to talk to other people, that are willing to listen, and that are willing to learn. So I think the experiences that we have during the boot camp in the summer, where we train the peer health educators, like yourself, I think is a great part of our educational program, because you learn how to interface with other teenagers that don't think the same way. You remember the summer, there were times people didn't agree with you, you didn't agree with them, etc. And we learned how to work that out. So a big part of our program is just learning how to work together and how do you provide a message, like you guys did with your advocacy projects, in a way that people understand, and in a way that people understand that there's different views. It's not just one way. So that's the efficient. And then in terms of, what was the third one you said? I'm so sorry.
Like how is it expanded in the fact that teens feel like they're learning something and that this is something that they're glad they had the experience with?
So I think a lot of it has to do, again, with the peer educators. I think that you guys' personalities and the fact that they, at point, look up to you and they come to you guys for guidance, they come to you guys for information. And the fact that we build a relationship where you feel comfortable coming back to us and that we continually are trying to give you more information for you to share with the peers, I think that's a real important component. The ways we're able to tell that we're making a difference is by the evaluations that we do. So the minute papers, sometimes we are asking teenagers, so were you at the class, did you like it? The other way that we know that they're learning is when we do not competitions, the games, and people get all into it, and it's like, you know, they want to win and they want to make the right, you know, make the right choices and give the right responses and stuff. That's when we realize how much they like and how much they've learned when we've done that.
So, what do you think are some steps for the future and some future things that you can continue with the YES program by the opinions and by the surveys that you've taken back on things to improve? What's some things that you want to improve?
So there's always room for improvement. I mean, I've been teaching for 25 years and stuff, and we get evaluations after each time, and everybody learns differently. So being able to be flexible enough to teach different people in different ways, I think is really, really important. And being humble enough to realize that we can always learn more. So yeah, I've been teaching for over 25 years. That doesn't mean that I'm a good teacher or I'm an effective teacher. I am, but you know, that's beside the point. But you could always learn, you know, you could always learn more, different styles, different things. So I think for the future, I think the things that would be great is for us to expand. One thing that we've heard a lot from the teens and the students is that we need to start doing these things in junior high school for younger kids. So before people have established their habits and stuff, to try to talk to them about the different things. So that's one thing that we definitely want to do. I think the other thing is funding. You know, in terms of sustainability, we need funding. So we need to be more creative in terms of getting funding so that we can teach students. And I think the third thing is we need to track the students better. I mean, it would be real nice for us to see what people do when they go on to college or junior college or their jobs, and to be able to ask them, how did their experience with YES motivate them either to do what they did or help them to do what they do in a better way, a more effective way.
So one of the things you mentioned was how we need more funding and how we need a little more so that we can have a little more creativity within the program. So being that you said that, where do you think that the YES program can be 5 years from now if we have that creativity, we take those opinions in consideration, and if we get the proper funding for this program? Where do you think it's headed in 5 years?
So I would think that in 5 years, we'd be able to negotiate either with large school systems. So it would be either Chicago Public Schools, or it would be the Catholic Archdiocese of Chicago, or it would be the local charter schools, or it would be the Alternative School Network. In other words, that we would present our model of what we've been doing for 14, 15 years, present our data and be able to say to them, this is something that you should buy into. This is something that you should do at your school. This is one more program that you can have, and it teaches skills like public speaking, it teaches negotiation, communication, health education. You can use it in terms of journalism. On our website, we have somebody working on blogs and students responding to it. So I think that's what I would like to see, is to be able to sell it so that we're able to do this in a larger scale. And the only way we're going to be able to do this in a larger scale is if we have the type of funding to be able to sustain that.
Now you mentioned the Catholic Archdiocese of Chicago, and I know a lot of Catholic schools aren't so much fond of teens learning and getting educated about their health and sexual education.
Sexual education.
But my question is, how do you think that you can get into private schools? How do you think you can get into the Catholic schools and explain why it's needed and explain why it's important in teens' life and why they need it?
Well, I think one of the things is to do some reality testing. The reality of the situation is that although we've been working in a Catholic school for the last 3 years, I have been asked as a consultant to go into Catholic high schools for decades to address things that have to do with reproductive health or sexual health. So the reality of the situation is that whether we like it or not, we are sexual beings. And you can be a sexual being, or at least aware of your sexuality and of a number of different things, and still be true to your faith, irrespective if you're Catholic or Jewish or Buddhist or Muslim or what have you. And so I think that as long as we respect the morality and the spirituality of the different faiths and what they believe in, and we don't do things that are disrespectful, I think it's important. I think it's also important for another reason, and I think most faith-based organizations like this one would agree to this, I may be wrong, that we need to empower our youth to be able to know the difference between what's right and what's wrong. And so we're not talking about sexuality, not talking about reproductive health. There's a lot of stuff that are not addressed that students don't seem to even realize it's wrong. And so issues of incest, issues of rape, issues in terms of what is appropriate and inappropriate touching. You know, all of those things, we would pray and hope that these are things that are discussed at homes by your family and that they establish what's right and wrong. But some people and a lot of parents feel very uncomfortable touching upon these subjects because they almost feel like teens nowadays know more than we do. But if we do not, as adults or as institutions, take the responsibility of sharing real scientific, evidence-based information about what's right or wrong, then that means that we're allowing social media to be telling people what's right and wrong. And a lot of information that you get on social media is wrong. And so I think to a certain degree it's an obligation. And I do think that it's part of negotiation. There may be parts and aspects that they do not want to address, but I think we can negotiate to give a foundation of health education information, including reproductive health, in such a way that respects the mores and the mission of the faith-based institutions.
So I can imagine that you're a very busy woman, that you teach, you're all of this, you're always around, got all these meetings and scheduling. So what drives you to continue to run Yes, and what motivates you to keep going and not just say, oh, my schedule's too busy, sorry, I can't do it no more?
Okay, so if I think of different age groups and which are the age groups that I like the best, love the best, it's working with teenagers. Because to me, it's a challenge. I never know what they're going to say or what they're going to do. And so you have to be like on top of it. You have to be ready to respond and to respond in a way in which it doesn't turn them off. And so to me, that's kind of a turn on for me. I like challenges. And the other issue is, you know, just like you may not think so, but I'm getting older. And in the future, I would like to feel that the young people that I've taught will have shared information with their peers such that I can feel comfortable that in terms of the decisions that are going on in the world, in our communities, and about health, that I can feel comfortable that that I've been able to make a positive impact in terms of health education decision making.
So what have you seen or heard that allows you to believe in Yes? Like, what are the proud things or the amazing, outstanding comments that have made you believe that this program is so successful?
So I think the biggest thing for me is sort of the before and after. Mm-hmm. To start at the boot camp at the beginning and look at the students and say, oh my God, who picked these people? And then realize, oh, I was one of the people that picked them. And then to be able to see them when they do their advocacy projects, that for me is just amazing. And then to be able to hear the schools say how they've been impressed with the students that have worked with us in the YES program. And then I think in the 14 or 15 years, one of the things that I've seen over and over again is that our peer health educators have been leaders. They've been the leaders at the schools. And they're being involved in the YES program, seeing that more and more that students go to them to talk to them, they look up to them, and that many of the students pick health careers, or pick careers like law, or pick careers like nursing, or pick careers like teaching because of what we've done. To me, that's a positive.
And my last question is, well, you just described a little bit of a moment that is interesting yet.
Oh, I thought you were talking about another moment because it's beginning to get a little warm here, so I gotta get this up.
But what is one of your favorite Yes moments working with the Yes program throughout these entire 14 to 15 years? If you had to choose like a couple, the one specific, what would be your favorite Yes moment and why?
I think my favorite Yes point, there's a lot, but just short-term memory. I think one of my favorite moments was a number of months ago. We had our funder wanted to do a site visit, and so they wanted to see us in action. And we were at Westtown, and it was a mixed group, females and males, and there was a competition. So it was a game, and divided into groups. And they did an awesome job, but the thing that I was so impressed about, and I'm going to stereotype a little bit, so I'm going to apologize. I know you shouldn't generalize, but I am going to make some generalizations. Females, teen females, sometimes know more about reproductive health and about options and about health care than males do. And so what I was impressed with was the amount of competition and the amount of time that was spent by the males challenging the girls on facts, even about their own reproductive health. Like males talking about female reproductive health, and they were dead on. So I was impressed at that interaction and that they had learned and that they felt comfortable talking about it. I was very proud of the person that was presenting the information. It gave me great faith in terms of the people that were teaching, the interaction with the teacher from there. And even afterwards, when it finished, I was happy, I was very proud, but especially when I received confirmation from the site visitor, and she said, I have never seen this. I have never seen a teenage group that was so into it, that was so interactive, and that was as knowledgeable in the fact that the males knew as much or not more than the females. That was a first also. So that was one of my moments.
And I think that is something that's amazing to know, that it's not just the females always trying to challenge the males, but to have males, like you just said, not only challenge the females on their own body, but maybe challenge the females on the male's reproductive system and see what we know, but also taking in some insight and some knowledge and saying, okay, well, hey, I didn't know this, but now I know it now, and now I can take it away and not have that mindset. I think I'm going to stereotype a little bit, but not stereotyping the, oh, girls don't know as much as we do, but actually realizing that maybe they do, but it's okay to accept the fact that they do, because females also take things from males that we never knew.
Yeah.
And I think that that's a great thing that's happening within schools, and hopefully that's going to happen within society, but I don't want to jinx it.
Yeah. No, that would be really, really important. I think the good thing about that, in public health, we talk about different types of prevention with different layers, and primary prevention is to talk to somebody about something and warn them and tell them what they can do to make sure they never get this. And that's primary. Secondary is that maybe they've already done it or been involved in it, or maybe have a certain illness, but you talk to them and you tell them this is the medicine, this is what you need to do to get better. That's secondary. And tertiary is when you unfortunately have suffered an injury or an illness, and all we're trying to do is make you feel comfortable, because there's not a whole lot else that we can do.
Right.
So, maybe like some type of cancer or something where you're really trying to make them comfortable and improve the quality of care. So the way I look at it is, when we do this education, we have an equal amount of people that are receiving primary and secondary prevention. Many of the things that we talk about with people, they have never seen, they've never experienced, they've never engaged. But then we have an equal number of people that have engaged, maybe in sex, etc. And so we're teaching them things. Sometimes I think they may not be able to apply things that will directly affect them immediately, but the happiness I have, or the joy I have, is that I know that in a different generation, when they have kids, they should be able to talk to them about these things, because they can't say what their parents said, which is, these teens know more than us. No, you're gonna know something about it, so you should be able to feel more comfortable to talk to your kids about it.
Now, lastly, before we go, one quick last question is, in the YES program, when you go and you teach this education, do you guys provide some type of resources or places that they can go, saying if they are sexually active and they want to get checked out, or if, say, they don't feel comfortable asking their parents for condoms or things like that, do you guys provide them, or are you able to provide them with places?
I'm trying to keep a straight face because I'm a parent, and I think you already know where I'm going to go with this. So I'm a little bit of a hypocrite because I'm an adolescent medicine person, but as a parent and stuff, when my kids were 13, 14, 15, 16, 17, I could keep going and stuff. I probably would have felt uncomfortable. They're asking me to use condoms. So I'm trying to educate people as to what they can do to prevent them from getting any kind of disease or illness, the ones that they can have some type of control over. But I'm not advocating for them to be sexually active.
Right.
And so when you said that, that kind of threw me off because I wanted to get that across. And I also wanted to get across, and you know this, that although we're talking about reproductive health and faith-based organizations, etc., that is not the only thing that we talk about. So we teach advocacy, and we talk about nutrition and fitness, and we also talk about dating violence, and we talk about what is a normal versus an abnormal relationship. So there's a lot of things we talk about, and I actually forgot what the question was.
So I was saying, are you guys able to provide those outlets and those resources? Because, like you just said, you have the nutrition and fitness type part. So maybe if they don't feel comfortable getting that inside the school, are you able to help them provide those places? Or if, like you said, the positive versus the negative relationships, the abusive, are you guys able to kind of reach out in a way to help them that it doesn't have to go to like the extremes?
Okay, so the first level is that we're providing education.
Right.
But the second level is that we're here as resources. And yes, we do have resources. So that's one thing that we're doing all the time is updating resources. I think what's a little bit different, and you experienced this summer in our boot camp, is that we don't just provide information. We challenge you guys to go into your neighborhoods and explore what are the options and what are the resources that are available, and then come back, bring the information, and talk about what worked, what didn't work, what's available, what's not available, what would be nirvana, what would be great if you had. So yes, most definitely, that's a very important part. Because education is one thing, but we need tools and skills to learn how to negotiate, how to communicate, how to seek out information, how to be a true health consumer, and that's it's all part of what we do at YES. So definitely. The other thing that we do, starting a little bit more, and is in terms of social media. So we have the Girl No More campaign, where we're trying to talk about HPV infection and HPV vaccine. And so now we have a blog, and we have a medical student who every week is putting some questions that have been, she has spoken to a group of medical students about HPV and asked them to share their concerns, the myths, the things that they learned, etc., misconceptions. And she's been posting them so that people can learn from them, and then she provides resources. It might be to the Centers for Disease Control, it might be to Chicago Department of Public Health, but providing resources as to places you can go and you can read more and or you can speak to people. I think the last thing that I would say about that in terms of until it gets too extreme, and I guess I'm talking about abusive situations because obviously we talk about that. The health educators and myself, we are mandated reporters, so that if you shared information with us that made us think that you were at risk of harming yourself or someone else, we're mandated to report because we need to make sure you're safe. And it's something that we share with each of you and in the classrooms, etc. And I think that helps us, because sometimes we're talking to a large group, just giving information, and then later on someone pulls us to the side and says, this and this is going on, then we have to look for more information. We have to provide them with resources. So that's a role we play too.
Well, it's been an honor hearing all the answers and all the positive comments and learning experiences that students have learned, but not only from my perspective of the boot camp and seeing how much it does change teens and how it does take such a positive impact on us, and hearing what you have to say about the program and really think it's going to be in the next 5 years is such an amazing thing. And I hope to come back and visit and
I
see where it's
expect
at.
you to do more than just
Because,
come back.
yeah, but come back, visit, see how things are going and see where it's at. But I appreciate you talking with me and having this conversation.
And I appreciate you. Thank you.
Thank you.